Today's topic is going to be about tennis elbow and epicondylitis. The reason why I chose this particular topic is it seems to be cropping up a lot. This is the time of the year where the weather is cooler. People are playing more sports here in Arizona. They're outdoors because it's now 70 degrees. And what I'm finding is, between clients and then people that I bump into at the gym, they're always asking me advice on how to deal with their, what I have termed tennis elbow, or painful elbow. What's really interesting is there's a select group of people that actually have tennis elbow as we know it, the repetitive trauma from swinging the racket, or the repetitive trauma from using a hammer or some kind of tool. And then there's another select group of people that the tennis elbow is created by lifting something, and that could be lifting a table, lifting a box, anything that may be too heavy for the forearm joints to handle. Okay. Anyway, a little lesson about what is epicondylitis or tennis elbow. Here's my picture of it. If you look, this is the long arm, part of the arm called the humerus. This is the bicep muscle. And these are the bones of the forearm. And this little red patch that I have outlined here is the specific tissue that becomes inflamed. That little area is on the side of the elbow, and the reason why it becomes inflamed is when an individual overgrips an object. Let's say the tennis racket handle is really small, there's not a sufficient amount of tape, and the person is forced to squeeze a little harder than normal, and that causes the muscles that wrap around the forearm, known as the flexors and the extensors, to become overloaded. So in this case of repetitive trauma, type of epicondylitis, that is usually due to insufficiently weak forearm muscles, that being the flexors on the top, the extensors on the bottom. So what you typically see is a person will swing a tennis racket, the ball will hit it, and the wrist will go into extension, and that will overload the flexors up front. So the solution with that, for that type of epicondylitis is pretty basic, and that is strengthen the weakest point of the forearm. That's the front, doing eccentric wrist curls, maybe some twisting. There's rubber bars that you can twist, which will also activate that, and maybe some hand strength. However, that form of epicondylitis only represents about 20% of the epicondylitis that is out there. Your typical person that actually gets an epicondylitis is someone who's lifting a heavy box or furniture or whatever, and then damages this soft tissue on the side of the ulna and the radius, or the olecranon process. So the question I have for you is, should we look towards the elbow as the primary culprit in causing epicondylitis or tennis elbow? My answer is no. And why is that? Well, if you look at the person who ends up hurting themselves by lifting something that's too heavy and it overloads their elbow, they have a postural problem. They have what they call a pronation syndrome. So what you'll see classically, posture-wise, is you'll see somebody with a forward head posture, meaning that the head will migrate before the shoulders, usually 2 to 6 centimeters forward. When that happens, the shoulders, which should be lined up with the earlobes, will migrate forward. We call that pronation. When that happens, the first rib will drop to about 15 degrees, and that will cause the upper and lower arms to pronate in, and that causes this candy cane twisting effect of this muscle around the ulna and radius, and that has been shown to majorly overload that soft tissue and cause ruptures. So I think it's important to look at that form of epicondylitis or tennis elbow versus the mechanical one from actually playing tennis, because the one related to posture represents 80% of the cases out there. So what do you do for that? Well, first thing you do is you have to quiet everything down, and that means ice, compress, rest, and I also recommend that people get a wrist strap, and you can get them online. On my blog, I have a link for that, so you'll get an idea what they look like. And also you can get an elbow split type of thing, which will actually wrap around this area and actually quiet the muscles down. So that's really important because you want to quiet the inflammation, because there's really not a whole lot you can do if the arm is in pain and it's actively inflamed. So anything that you do at that point will actually make things worse. So once you quiet that down, and it'll take usually a few days, then you should go into a corrective exercise program and start working on the parts of your body that are actually creating the dysfunction, and that is usually the shoulders. And there are corrective exercises that you can do to cause a pinning of the shoulders back, an external rotation of the arms, and then put the body back in alignment. And it doesn't take a lot of time to do that. Most people that I work with, or I've actually seen who have actually worked with therapists who do that, usually get complete resolution anywhere from like 2 to 6 weeks. And then of course they have to maintain that particular program if they want to be able to lift things or whatever that would cause the problem to arise. Again, if you stop doing that, things will come back. So you want always to make sure that you're involved in some kind of maintenance program for your body, and it's good for your body altogether. Anything that creates a better posture is an anti-aging remedy in itself. This is not something that you're going to hear from physicians, and that being is that physicians always lean towards the perfunctory treatment, and that is ice, rest, and compression. It's not so they refer you to the actual physical therapist or a hand therapist. You actually have them actually look at it. They may do an ultrasound or shockwave therapy to the area. They may put what they call a mulligan wrap, which is like a kinesio tape to alleviate the tension on it, and then they'll give you some therapeutic exercises. Again, even at that point, that physical therapist has half of the remedy. Half of the remedy is actually looked at, but there's another component, and that's the posture. So you must go see somebody that deals with postural abnormalities, and that is a special type of physical therapist. So there's not many out there. They're called physiatrists. At any rate, once you get your body taken care of and you get the stabilization done, work on your core a little bit, then you can actually find that these symptoms will actually go away. So my advice is splints, postural analysis, postural correction, work on the intrinsic core. One thing about tennis players or golfers is what you normally see is this thing called the Milwaukee tumor, too much beer. And so when you have this prolapse of a belly, how can you possibly rotate in the 25 to 45 degrees that you actually need to swing a tennis racket? So if you have an extension, the muscles are in a lengthen and tighten phase, you have no rotation. So what ends up happening is you end up slopping your arm around in a kind of a whip type fashion, and that will lead to this tennis elbow or a golfer's elbow. So anyway, focusing on your posture and core conditioning and increasing the range of motion of your core is absolutely important. So it's up to you. You can do the rest in the ice, but I promise you that that won't do anything for long-term benefits. You're just going to find yourself having that pain that waxes and wanes throughout your life. You can use the splints. However, the splints above and below are only a band-aid. And once you stop using them, the pain will come back again. So if you want to be dependent on splints, that's really your prerogative. I don't recommend it. And another reason why I don't recommend it is it actually makes the muscles weaker. It actually shuts them off. So now it's like if you put your leg in a cast every day, the muscles in your leg will be weak, and then you'll start limping. So why would you do that to your arm if you're an avid athlete or if you have to pick things up every day or whatever? So be smart about things. Be proactive. Make sure that you evaluate your situation, seek the proper prescription, find the proper professionals to help you out with this. And there is a lot of information out there available to you. In fact, attached to this video is a link to my blog, which has a step-by-step recipe on how to take care of this epicondylitis or lateral tennis elbow. So take a look at it. I would love to get your feedback and let me know if it's helped your elbow pain ameliorate. And I wish you the best. Have a good day. Bye.